See, first we have to understand what is the meaning of competence. Competence is ability to use acquired knowledge and skill in practical situation. Somebody may be knowledgeable. You may be knowing the steps to perform bone marrow aspiration. But if somebody is asked to perform bone marrow aspiration, he or she may not be able to perform. They have knowledge, but what is lacking? That ability to convert that knowledge into actual practice. This is called competence, and this is very important in our laboratory. And for this competence, what is required? One thing is initial competence assessment. When you are appointing a new person in your laboratory, whether that person is laboratory director or a lab assistant or maybe housekeeping staff, the person should be able to carry out his or her duty. So what all shall be done for this initial competence assessment? And it's ongoing competence assessment periodically. When we say periodically, it is not saying you carry out this activity once in 3 months or once in 4 months, but time to time, depending on the organization requirement, you have to carry out this. For this, what is required? For this competence assessment, first you are evaluating. You want to appoint somebody as technical staff. Maybe you want to add some more specialty, molecular. You want to start molecular for infections or hematological malignancy or some other malignancy. After that, you are evaluating whether some existing staff can be trained or you need some additional staff. So you have to carry out all this evaluation before reaching to any conclusion. After that, you're deciding, okay, we need to appoint one more person for this. Then you have to define what will be the responsibilities of that person. So with that, and what all authorities will be given to that person. You're deciding their job description. What all you are expecting from that person. One thing is, generally when we talk about job description, we say after appointment, we tell a person these are his or her responsibilities. But before that, before the appointment, you have to decide you want a person for these responsibilities, and we will appoint that person who will be able to carry out all these activities. So that way you are first describing job description. After describing job description, then you are specifying what should be the qualification of that person. When we talk about qualification, we talk about education. This person shall be maybe, if it is technical, technician, MSc in biochemistry or DMLT, whatever you are deciding, or for authorized signatory, say somebody has to report flow cytometry in lymphoma leukemias. You are saying we will appoint somebody with MD pathology or DM in hematopathology with experience in flow cytometry. That way you're specifying the qualification and any training or experience required. So then you're deciding, okay, we will design our application form in such a way we will get enough information. Then you can say we will update this on our website, or we will give this advertisement in some national newspaper. If you are in government organization, your procedure may be different. If you are in private organization, your procedure may be different. And then after this advertisement, you are preparing a checklist, or you can say some questionnaire. What all you will ask in the interview. Because ultimately, what is our intention? You may be wondering, here we were supposed to discuss the competence assessment, and what all we are discussing. See, with this process, and you must have seen in the new standard, everybody is talking about process. Process means flow of activity. This is our process of competence assessment. And in this clause 6.2.2, standard is also talking about process. What should be the process? How to develop this process? So you are preparing a checklist and you are asking those questions. And if somebody is satisfying all those requirements, you're selecting that person in your organization. So you're quite confident, whomsoever we have selected, that person will fulfill our requirement. After that, you have developed an orientation program for that particular person. You have developed an orientation program for that particular person. If the person now has to work in our laboratory, we will tell him or her how we are running quality controls, how we are analyzing this quality control, how we are performing daily maintenance, weekly maintenance of the machine, how we are informing critical results. If all these things are in the job description of that person, you are taking care of all these things. So with this, you are quite confident that the person will be able to carry out all the requirements. If you feel something is, and if you are part of the hospital, then in your orientation program, a round to hospital, a requirement related to hospital is also included. And you are conducting a brief training. If the person already knows everything, still you are conducting a brief training related to his or her work process, and there will be ongoing training on various aspects. Whenever you are conducting any training, one thing is post-training evaluation, whether the person has understood the contents of training or not. And also competence assessment, ability, whether the person has developed ability to use that knowledge in a practical situation or not. Otherwise, what is the purpose of training? And what is this performance management? Performance management is whether the person is, one thing is person has understood the contents of training, another person has developed the ability. But another thing need to be assessed, whether the person is performing that activity in a required manner or not. Suppose you are appointing a person may be very intelligent. Your organization timings are from 9 to 4. Person is coming at 11 o'clock, going for lunch at 12:30, coming back from lunch at 2 o'clock, and going home at 3 o'clock. What is the purpose of all these things? Performance is not satisfactory. Or if the person is misbehaving, with his or her colleagues. So all these things are important, and you are providing opportunity for continuing professional development, either conducting some knowledge developing program within the organization, or you're sending them outside the organization. Ultimately, what is happening with all these activity, person will develop more confidence and more ability to carry out a particular activity. What is this called? This is competence. And if everyone working in the laboratory will work in this manner, definitely the quality of the work will improve. And this is the requirement of your standard, clause 6.2.2 also. And if you see, this may be your policy. The laboratory is committed to the recruitment, training, development of the staff, and retention of the staff at all levels in a manner that ensures that they are competent to be fully involved in the work of the laboratory. If the person doesn't have ability, he would like to skip some activity, but if he is competent, he will be involved in an activity with more zeal, more confidence. When we talk about this competence, one thing is core documentation. Another thing is specific documentation. In core documentation, ability to communicate is very important. This is part of the competence. For different level, you need different level of ability of communication. If suppose somebody is technical staff, the person may have to communicate with 3-4 persons in the laboratory. But if that person is lab director, the lab director may have to communicate with the administration. The lab director may have to communicate with the patients, with colleagues, with superiors, with accreditation body. They have to communicate with so many people. So for this, a greater ability of communication is required. So this is the core dimension of the competence, which is required with everyone, whether the person is in histopathology or in microbiology or in biochemistry or quality manager. Then personal development and development of other people. This is also important. One thing is person should be able to develop his or her ability and support others to develop their abilities. This is also important. Sometimes when we think about competence, we think only about whether the person is able to perform a test or not, if the person is biochemistry technician. But if somebody is working as senior technician or senior most technician, don't you think it is his or her duty, in addition to developing himself or herself, helping others also to develop, so that at a later stage they can also take the command of the laboratory? Then health, safety of himself or herself, and health and safety of the other people. Then service improvement, how you are carrying out activity, how we can improve those things. Suppose at present you are handing over a report in the evening to patient hard copy, you can think about how we can further improve our services. We can send these reports through mail also. We can send these reports through WhatsApp also, or we can upload on our website. This is improvement in the service quality. You can improve the quality of your own work. You are maintaining records properly. You are keeping your desk clean, everything organized. You are also guiding others to carry out these same things. And this is also very important aspect, equality and diversity. You're treating everyone as equal. They are also human beings. And diversity. You're working in cosmopolitan city, different people, they are working with different, they're coming from different cultural environment, different socio-economic environment, taking into consideration everyone. So you're respecting this diversity and you're respecting this equality. These are the core dimensions required by everyone. It should be part of your personality. Wherever you are working, whatever capacity you are working. As we discussed in communication, if suppose somebody is interacting on telephone, how the person is communicating. As we were discussing health, safety, and security, now I'm explaining a little bit more about all these things. These core dimensions, these are very important. Cleaning and removing spillage of blood and other body fluid from the workstation. And certain things you're advising. You take care of your health, certain self-testing of their body, some routine investigations, so that everybody is able to maintain a good health. And how they are collecting samples, you are helping them. If you are in sample collection area, how to perform a particular test, how to interpret the findings, then various activities related to laboratory, how these samples shall be packaged. Now, this is part of your standard also in transportation in clause 7.2.5. Sample transportation packaging is very important. You're transporting specimen and samples. Again, 7.2.5, you are receiving samples. Then disposing biomedical specimens, your clause 7.4.2. You're preparing various culture, media, and solution. Whatever activity one has to perform, these are the examples of some of the activities. The person should be able to carry that activity. It is not adversely affecting the test. If you are performing some test, whether it is simple or complex test, you should be able to perform that. If you have to perform microscopy diligently so that you are not missing any part. Now see, if you are defining job description before appointment of a person, so how this will help in the competence of the person. First, you're evaluating what is the duty one person has to perform. There may be some overlapping. A person is already performing some activity, you're appointing one more person. You're saying this person will perform these four activities, but in addition, if required, he is also competent to carry out those two additional activities for which at present we have only one person. So this will help you in increasing the number of competence person without increasing the burden on the laboratory. And also, you're assigning these responsibilities, and whosoever, when you are designing application form, they will get the clear understanding. If we will get this job, what is the expectations from us? As a manager, you will know, okay, they are applying, they will carry out this activity. As applicant also, you know, if I am joining this organization, I have to carry out these activities. With this induction training, what happens? There is better communication. In your organization, you know, the person has completed induction training. That means he has understood how our organization is working, and regularly are conducting training on various aspects. With this, it is clear that now they know what are the ethical principles of our organization, what a person is expected to do in this laboratory. With this competence, you are confident, okay, the person has understood, or the person has ability to work in a required manner, and you are checking performance, okay, the person is working well, we are satisfied with his work, and also you are providing opportunity to increase the ability. So this, when you are developing a job description, after that you are creating a application form, then you are specifying this qualification. When you are specifying qualification, that means education and training and experience required. See, the difference is here you are writing what you are expecting from a person. Here now you are writing based on this job description, what should be the qualification, training, and experience of that person. So this will help you in better evaluation. You will recruit correct person who will be able to fulfill your job requirement. They will be able to understand this induction or orientation. They will not ask you any technical question. They already know everything. Only thing is orientation is required, conducting a brief training, and after that you are checking the competence. You will find everything okay. For this competence, what is required? A regular training on various aspects. Because ultimately, what is our expectation? Ultimately, what is our expectation? Our expectation is person should be able to work in a required manner, should be able to work independently if it is required. Saleha Tabassum, please unmute yourself. Akshay? Yes, Akshay, am I audible? Akshay, am I audible? Dr. Neha Shah? Sonal Tagare.
Yes, sir.
Sonal, am I clearly audible?
Yes, sir. Yes, sir.
Okay, right. When you are conducting training, include awareness of the quality management system as part of your training program. A brief understanding as per the requirement of a particular person, a understanding of the laboratory information system, and what all duties a person has to perform, assigned work processes and procedure, and he should be able to know where the person stands in a process. Suppose your pre-examination process is, first person is coming to registration counter, from registration counter you are referring the patient to sample collection area, from there samples are transported to accession area they are receiving sample, and then samples are transported to workstation, laboratory. If a person responsibility is transportation of the sample, the person should know in this pre-examination process, my responsibility is related to sample transportation. I should know this, how sample is registered at the registration counter, how they are receiving at the registration counter, or how they are collecting. That is not his or her responsibility, but the person should know his or her work clearly. Then training on health and safety, like adverse incident, needle stick injury, etc., spill management, ethics of the organization, and confidentiality of patient information. All these should be part of your training program. After this post-training evaluation, one thing is what all shall be included. Then, what is the purpose of this training? Why we are carrying out this training? See, you are telling your people, according to the requirement of your organization, this is the method of proper sample collection. This is how patients should be prepared. This is how sample should be labeled. And if suppose some fixative is required, this is the fixative required. This is the processing required. How this sample shall be transported. And if it is taking some time, how this sample shall be stored before testing, and how after testing the sample shall be stored, and for how long. For this, a training on pre-examination is required. After this, post-training evaluation and competence assessment. Then they have to carry out all standard laboratory procedures. Skill related to that, they should be able to carry out. And how the particular instrument shall be used, even a pipette or complex instrument, how preventive maintenance, how this calibration shall be done in biochemistry. Sometimes you have to calibrate individual parameter if something is required, some troubleshooting ability, working knowledge of the reagent stability, if reconstitution is required, how to carry out that. But all these things, ability, they are able to carry out these independently. If they have to carry out independently, it is not every time they are asking their superiors how to carry out this simple activity. This quality control or awareness of the factors which can influence test result, skill required to assess and verify the validity of patient result. What is the clause related to this? 7.3.7, before releasing the patient result. First, we discussed what is the requirement, what all shall be included. Then we discussed purpose. What is the purpose of this training? Now the thing is how to perform this assessment of competence. Because after training, there is post-training evaluation, and after that, competence. So how to carry out this competence assessment? This is also important. One thing is direct observation of patient test performance, including patient preparation and sample collection. You are observing how a person is receiving sample in the accession area where the person is required to receive the specimen. They are checking, you are observing how whether they are carrying out this activity or not. You are observing whether the person is checking or not. The sample is labeled, required information is there. Required information is there on the test request form, and both informations are matching with each other. This is the direct observation of a activity, right? Or how they are informing some critical result telephonically. This you are observing. This is direct observation. Monitoring, recording, and reporting of results. You are checking if somebody is writing some result on a paper or in a register or typing on a computer, whether they are carrying out this activity correctly or not. This you are monitoring. Then review of intermediate test result or worksheet. Intermediate test result means you are not releasing this to patient. You are noting down IQC result on some worksheet. Or noting down some patient result from machine to your register, or result of EQUAS, or you are checking the records of preventive maintenance, or you are checking the function of a instrument. One day you are checking temperature, a record of a instrument, maybe refrigerator, whether everything is maintained in a required manner or not. Or test performance on already analyzed sample. You are asking your staff to analyze a sample which has already been analyzed, or you are telling the person doesn't know the result, some blind sample, or you are asking them to perform on a EQUAS sample. Some problem solving skill. This is also important. Problem solving skill. This can be some simulating challenge or simulated challenge. You are saying a CSF sample is arrived in your laboratory and the sample is not labeled. Request form is completely filled, but the sample is not labeled. Now, what will you do? Will you reject the sample? Or you will process the sample? Or you will discard the sample? Or you will say, I will talk to my senior. What is the action required? Or you are encouraging your people whenever they are facing any challenge, they note down and they also note down what is the action required. So that way we can carry out this competence assessment So what is required? First, we have to understand what are the requirements, what all shall be included in the training. Then what is the purpose of this training? Why we are carrying out? Then after training, we are conducting post-training assessment. But ultimately, what is important? This competence assessment. And what are the different ways of carrying out this competence assessment? And after competence assessment, it is important. Person is competent, but the person is actually carrying out all the activities required or not, or the person is neglecting the work, or person is not behaving properly with his colleagues or her colleagues. And what you will review? You will review what all are expected from his or her job, whether they are carrying out those activity as per the requirement of job description or not. Because at the time of appointment, they agreed, okay, we will carry out these things, whether they are performing all those things or not. And it is possible if suppose the person has to perform 10 activities, 8 activities the person is performing, and 2 activities he may say, or she may say, I'm not able to get what I am supposed to do. So you can plan some development activity for that. How to carry out those activities. The person is learning those. You're creating some development plan. How to teach those 2 things. And after that, you are assessing. Yes, now he has understood. After that, you are evaluating. Then you are feeling confident. And then the person is involved in routine activity. And after some time, you are again reviewing whether the person is carrying out those activities in a required manner or not. So that way, see, this is a process, sequence of activity, flow of activity. So you must have seen in the new standard, everyone is talking about process, process, process. So if we develop processes within our laboratory, so it is easy to implement, and we can see if suppose we are reviewing and we are finding some gap, and then we are not planning anything, then what is the purpose of that review? If we are planning, but we are not developing any program, how to carry out that activity, or if we are just for the sake of documentation, we are saying we have conducted one learning program, but if we are not evaluating whether the person has understood in a required manner or not, what is the purpose of that learning? So for things, for different activities, try to develop some program, some process. Then you will be able to implement this standard. You will be able to carry out different activities of your laboratory more effectively, right?